Hello, my name is Anya Sheftel, and I'm with the Washington State University team working in collaboration with the Extension Collaborative on Immunization, Teaching, and Engagement, or EXATE. This is the first one of 3 motivational interviewing modules as part of the Getting to the Heart and Mind of the Matter Toolkit. There are many other modules for you to use to help you learn from the toolkit. You can watch any of our other videos about motivational interviewing, science media literacy, or neuromarketing by clicking on the link for each of the modules below in the description of this video. So I'd like to introduce myself again. My name is Anya Sheftel, as I mentioned, and I'm the author of the motivational interviewing portion of the toolkit. I'm a research assistant professor of special education at Washington State University and a licensed psychologist. I have been a motivational interviewing practitioner since 2006 and have been a member of the International Motivational Interviewing Network of Trainers since 2008. So in my motivational interviewing career, I've worked in healthcare settings, I've worked in community mental health, schools, vocational rehabilitation, and university settings. So I'm really excited about this topic and look forward to talking to you about it here. Just a couple of other things about me. I'm originally from Russia, so if you hear an accent, that's what it is. And sometimes I stutter, so you may hear that as well. Great. So let's go ahead and jump into the topic of this module, which is what is motivational interviewing? On our agenda today, we'll talk about what it is. We'll talk about the components, so the spirit, change talk, technical skills of motivational interviewing, and motivational interviewing processes. All right. So what is motivational interviewing? Or a better question is, what is the goal of motivational interviewing? The goal of motivational interviewing, or MI, is to engage a person in a guided conversation that evokes and reinforces their own reasons for change. So you can think about it as a guided or a guiding conversation where we as practitioners are serving as a guide to help the person get to their goal of whatever behavior change they want to engage in. So when you're thinking about a guide, I'd like for you to think of a continuum. On one end of the continuum, you have the person-centered approach. On the other end of the continuum, you have more of a directive approach, right? And motivational interviewing lives in the middle of these. So it does have the person-centered approach in that way that we are having a conversation with the person, we seek to understand them, we are demonstrating empathy, and we are actively listening to what the person has to say, right? So that is a big part of motivational interviewing. Yet, if that is the only thing that we were doing, if we were just being with a person and just having that conversation, it wouldn't be as efficient of helping to guide them toward change. So that is why we need the directive part, which is evoking and reinforcing statements about a behavior change that a person is working toward. That being said, if we only had the directive part and only listened for and reinforced the change talk, but didn't really have that empathy and curiosity about the person, that also would not be an effective way of guiding a person toward change, because they might become they might not be engaged in that conversation because they might feel like we are trying to lead them towards something that they are not interested in, right? So when we're having a guiding conversation, we are combining the person-centered, so empathy and curiosity and active listening, with evoking and reinforcing change talk, and the synergy of both of these approaches then results in an effective way of guiding someone toward change. Motivational interviewing has been used in healthcare for over 3 decades and is an evidence-based practice within that setting. And recently it has shown promise in decreasing vaccine hesitancy. So we hope that this topic is going to be applicable to all of you out there who are working with community members or other folks around healthcare or nutrition or other topics that that might be important for your work with other people in the communities. All right, so let's talk about the components of motivational interviewing. We talked about what it is, right? Kind of like this broad overview. Let's now talk about the discrete components of motivational interviewing. So going back to the person-centered or the relational part of motivational interviewing, we're thinking about motivational interviewing spirit, or MI spirit. You can find out more information about it on page 20 of the toolkit. So that spirit or stance that we hold, we always hold the stance in our conversation with the person. It's not something that we use in the beginning and then abandon, right? That stance of my spirit of partnership, acceptance, compassion, and evocation is ever present in our conversations with people. With partnership, right, we enter the conversation with the idea of working together with a person, having a conversation with them. And so the partnership piece of that is that a person is an expert on their own lives. And so we need to work in a collaboration with them, not kind of show up and tell them what they have to do, but rather elicit from them what they want to do and what would be the best way for them to do it. Acceptance is another big part of motivational interviewing, accepting every person where they're at, right? Supporting their autonomy, affirming them. And then compassion follows that. The idea that everybody is doing as best they can with the tools and the resources that they have available to them. And then evocation. Evocation is this piece of motivational interviewing that highlights the importance of listening. Right? We as MI practitioners listen more and talk less. The idea behind that is if we provide the space for other folks to talk, it will help them clarify what they think and what they want. Okay, so that's the motivational interviewing spirit. You can think of an acronym PACE. We're pacing our conversations with the other person. So then again, we're thinking about that change talk piece of motivational interviewing, kind of that directive piece is the idea behind motivational interviewing is that as we evoke and we listen to the person, we are doing so with the intent of having increased frequency of statements about change, because the more a person is going to talk about change, the more likely they are to engage in a new behavior. So when we talk about change talk, and you can find out more information about it on page 23 of the toolkit, we're thinking about the statements of desire to change, ability, reasons, need, commitment, activation, or consideration of change, and taking steps. Right? So if we can listen for statements like that, and if we can use the technical skills of motivational interviewing that we will talk about in just a minute to evoke more of those statements, then we're supporting that movement toward change. And right, like, so how do we do motivational interviewing, the technical skills of that? Here are some of them, and you can find out more information about them on pages 25 to 33 of the toolkit. So the first one, avoiding the writing reflex, it's a technical skill, but it's also a relational skill too, right? So when we are having a conversation with someone, we are not going to offer information or unsolicited advice that the person is not interested in hearing. Because if we do that, then we really get caught up in interpersonal discord. I'm sure you all have had experiences of having conversations maybe with healthcare providers or other people in your lives when they're telling you things that are helpful but are not a good fit for you, and you kind of start to feel like, I don't want to have a conversation with this person anymore. They're really not understanding where I'm coming from, and getting into this place of butting heads. when we are in interpersonal discord, nothing productive can be done. And let's be honest, right? If information, advice was really helpful in changing behavior, we would have nobody who would be smoking cigarettes right now. Right? The public health campaign around smoking cessation has been huge. Yet, whenever I'm in a big city, invariably I see somebody smoking a cigarette next to a billboard that says that smoking is bad. Right? So we know that just information or advice is not super helpful. It needs to fit in with what the person wants. And so if we avoid the writing reflex and fall back on evoking, coming alongside and understanding, then we can really create the momentum for change. So how do we listen effectively? Well, we use reflections. Reflections are statements that indicate to the person that we are listening to them and that we are understanding what they're saying. So not just listening, but actively providing them with evidence that we are understanding what they're saying. So a reflection can be a simple restatement. So if somebody says, I get out of breath when I walk up a flight of stairs, so I think I should cut back on my smoking, but I've been smoking for 25 years, and I know it's just going to be really hard to do that. A simple reflection could be, you're noticing you're getting out of a breath when you're walking upstairs, and you're thinking about cutting back. Right? It's just a simple reflection. We're not adding a whole lot to that. We can amplify that or make it more complex by highlighting underlying meaning or feeling of a statement of what the person had said. So in that instance, a complex reflection of meaning could be, you're starting to worry about your health and where you might end up if you continue to smoke as much as you are doing right now. Right? So that could be one complex reflection that hopefully would evoke some of the change talk about, I need to change. I have the reasons to change my behavior. Another example could be a reflection of feeling, which is highlighting the underlying feeling, right? You're feeling a little worried and you're curious about what is possible if you were to change something about your smoking. Right? So it's kind of highlighting that feeling. And again, with the idea of evoking change talk. We're not going to add anything that the person didn't say, right? We're not going to step outside of the frame of what the person has shared with us. We're just going to listen for that underlying meaning of feeling and offer it back as a statement. Open questions, I think all of you probably know what they are, right? They're questions that require more information than just a yes or no answer. And then affirmations. Affirmations are huge, right? We want to be seen. We want to be seen as capable people. And when we're able to affirm a person's strengths, their values, or their goals, we really solidify that engagement and again, amplify the momentum toward change. So how do we structure NMI conversation? That is the $100 question, right? Especially for someone who might not have a lot of experience of doing motivational interviewing. So the NMI processes provide a bit of a blueprint for that. You can find out more information about those on page 22 of your toolkit. So we start with engaging. We want to get to know the person, right? We're going to be talking to them about some kind of change, and any behavior change can feel pretty vulnerable, right? It doesn't matter what it is. I've had folks feel emotional about needing to drink more water, right? Behavior change has emotions attached to it. And so we need to have that engagement and show curiosity about the person, not just about their behavior, but about who they are. So we want to get to know the person. Then we want to create a focus for the conversation. Even within the smoking cessation example, there are many options, right? So, even saying, some folks, when they think about changing their smoking, they think about cutting back, or think about quitting, or they think about just finding out more information about what it could look like. What would be the most helpful thing for us to talk about today in getting that person to choose the focus for the conversation, right? We're going back to the partnership and collaboration. Then once we have a focus, we can start to evoke and reinforce statements about change. And if appropriate, if a person wants to, they could come up with informal or a formal plan of action going forward. Planning is not something we're going to force onto anybody, though. So if a person says, I don't want to come up with a plan, we're not going to do that. All right. So what did we cover today? We talked about what is motivational interviewing. We talked about the components of motivational interviewing and the motivational interviewing processes. And I'd like to thank you for watching and learning with us today. And again, we'd like to thank the Excite Foundation through its interagency agreement with the USDA National Institute of Food and Agriculture and the Centers for Disease Control and Prevention for funding this project. We hope this toolkit is helpful to you and your communities.